To begin setting up the SphygmoCor system, plug the SphygmoCor unit into a laptop loaded with the SphygmoCor software using the USB cable. The laptop will power the SphygmoCor unit. If you are using a printer, turn it on and connect it to an unused USB port on your computer. Open the lid and place the tonometer in the holder so that it is ready for use. Whenever the system is not in use, replace the tonometer in the tonometer dock and close the lid. SphygmoCor pulse wave analysis is performed to measure central blood pressure, the pressure at the ascending aorta, and assess arterial stiffness. Take the subject's brachial blood pressure. As always, strict compliance with procedure is vital in assuring accurate brachial blood pressure measurement. Before performing a pulse wave analysis, make sure that you and your subject are in comfortable positions and that the surface that you use to support the subject's arm is completely stable. Assessments may either be performed with the patient seated or supine. The patient should be in the same position for brachial blood pressure and SphygmoCor testing. To begin the process, double-click on the SphygmoCor icon located on your computer's desktop. To begin performing pulse wave analysis, click on PWA on the left-hand column of your computer screen. To enter a new subject into the database, click Create New and click Yes to verify. When the data has been entered, click Update to save the data and Yes to verify the entry. The subject identification will appear at the bottom of the patient list on the screen. For follow-up studies on subjects, do not create a new entry. Simply click anywhere on this row and the subject information will appear. To locate a subject, right-click on the list and sort. To begin an assessment, click the Study button near the upper left of the screen. Verify that the radial checkbox has been selected by default. Enter the subject's systolic and diastolic pressure values in the appropriate boxes. Enter additional information needed in the medication, notes, height and weight, and operator fields. Click the Capture Data button on the upper right of the screen to save the data. The SphygmoCor system captures the radial blood pressure waveform by using the tonometer to slightly flatten the center of the radial artery by gently pressing it against the underlying bone. A tiny sensor in the head of the tonometer records radial blood pressure waveforms. The SphygmoCor system uses a proprietary algorithm to derive the blood pressure waveform in the subject's ascending aorta and produces a wealth of central blood pressure data. To record the radial pulse wave, begin by locating the subject's strongest pulse point. Use just the tip of your fingertip and a gentle touch. Applying too much pressure or using a larger area will make it difficult to locate the strongest pulse point. Once you've located the strongest pulse point, you may wish to mark it, or simply note a nearby mole or freckle. Hold the tonometer in your dominant hand and use your other hand to support the patient's wrist, resting your arm on a stable surface. Allow a slight amount of backward flexion of the patient's wrist. You may use a small folded towel to promote this flexion, always making sure that the patient's arm and wrist are comfortable and not overflexed. Position the tonometer over the site of the strongest pulse point and prepare to take the measurement. Hold the tonometer firmly at the sides of the base, not the shaft, keeping the shaft perpendicular to the skin surface. Hold the tonometer over the strongest pulse point and visualize the dark gray sensing element at the center of the tip. Gently lower the tonometer so that the sensing element touches the strongest pulse point. Allow the tips of your fingers to rest on the patient's skin. Make sure your elbow, forearm, and hand are stable so the subject's hand is held without movement. When the tonometer sensor touches the skin, you will see a pressure signal on your computer screen. If you are applying too much downward pressure on the tonometer, the signal will climb to the top of the screen. If you are not applying enough downward pressure on the tonometer, the signal will fall to the bottom of the screen. Angle the tonometer and vary pressure until the pulse waveform is clearly seen on the screen. If you're unable to locate the pulse waveform after 15 to 20 seconds of altering angle and pressure, repalpate for the strongest pulse pressure location and try again. When the pulse waveform appears on the screen, at first it may look small, but if you see a smooth waveform, hold your tonometer position and wait until the wave reaches the right side of your screen, at which point the software will automatically amplify the size of the signal. If you're unable to achieve signal amplification, which tells you that a strong signal is being recorded, apply a little more pressure to the tonometer, or look for a stronger pulse location. The goal in pulse wave analysis is to record about 10 seconds of consistent, continuous blood pressure waveforms, which takes 2 sweeps of the computer screen. The waveforms should be tall, filling at least half the screen. They should be of consistent height. The peak of each wave should be near the same vertical position on the screen. Each waveform should have a sharp upstroke, from the onset of the pulse to the peak of the wave. If you see a curve in the upstroke of the wave, this is artifact, which can be removed by slightly re-angling the position of the tonometer. When you believe you have seen 10 seconds of good quality waveforms scroll by on screen, touch the spacebar on your computer within 2 seconds. The SphygmoCor system will record and analyze the last 10 seconds of recorded pressure waves. Remember, you have 2 seconds to hit the spacebar. When you touch the spacebar, the SphygmoCor system will show the report screen. The report screen has 3 tabs: Detailed, Clinical, and Reference Range. Click on the Detailed tab. On the Detailed screen, the radial waveforms you collected, the average radial pulse wave, and the subject's brachial blood pressures are displayed in white. The subject's central blood pressures, derived from the radial data by the SphygmoCor system, appear in yellow. The screen shows 10 seconds of aortic pressure waveforms, the average aortic pulse wave, and central blood pressures, all displayed in yellow. In the upper right-hand corner of the detailed screen is the quality control box. AtCor Medical recommends that assessments receive a quality control score of 80 or higher. The system displays an overlay of the 10 seconds of radial waves collected during your assessment. The waves should be consistent in shape, with little variation. To the left of the radial waves is a column of colored numbers rating the height, consistency, and shape of the waveforms you collected in your study. To meet quality control criteria, all these numbers must be displayed either in green or white. If red numbers appear, or if a large red note label appears above and to the left of the quality control box, the study must be repeated. The operator index assigns a quality control score for each individual test. AtCor Medical recommends that assessments receive a quality control score of 80 or higher. If the operator index level is below the acceptable level, or if red numbers or red note label appear, the study must be repeated. If the study data meets quality control criteria, click the Print button. If the study needs to be repeated, click on Study, then click Capture Data, leaving the other patient data in place. For subsequent studies on the same subject, simply go to the patient screen and select that patient's name. Then click on Study. In most cases, pulse wave velocity studies are performed to assess the stiffness of the aorta, measuring the speed of the pulse wave between the heart and the carotid and femoral arteries. Before beginning pulse wave velocity assessment, place the patient in a supine position and allow 5 minutes of rest. If you are measuring the carotid pulse, remove any pillows and make sure you will be able to tilt the subject's head back. Plug the blue ECG cable into the SphygmoCor module. Apply fresh ECG pads onto the subject, using either of these configurations. Clean, and if needed, shave the skin in the areas of application to assure secure skin contact with the ECG pads. Palpate and mark the pulses that will be used in performing the pulse wave velocity test. To find the carotid pulse, tilt the subject's head backwards and away from you, and use the tips of your fingers to locate the strongest pulse. Mark this location with a felt pen. Arrange the subject's clothing to expose the femoral artery. It may be helpful to position the subject in a frog leg position. Palpate the femoral artery and mark the point of strongest pulsation. To begin the pulse wave assessment, start with the patient screen. click on the PWV button located on the left side of the screen. Now click on the Study button. The PWV study screen will appear. Enter the first pulse location you will measure as Site A. Enter the second pulse location you will measure as Site B. In a carotid to femoral pulse wave analysis, Site A would be checked as carotid, Site B as femoral. Place the tape measure at the suprasternal notch, located at the top of the sternum. Carefully lay the tape measure down the center of the body, tracing the path of the aorta. When you reach the umbilicus, angle the tape to reach the chosen femoral pulse location. Enter the distance in millimeters from the suprasternal notch to the femoral pulse location in the distal box. If your tape measure is in centimeters, you must multiply the results by 10 before entering the distance. Next, measure the distance from the suprasternal notch to the carotid artery pulse previously marked. Enter these results in the proximal box. Remember to multiply the results by 10 if your tape measure is in centimeters. Take the subject's brachial blood pressure measurement using careful technique. Enter systolic and diastolic blood pressure into the appropriate boxes. Enter additional information needed in the medication, notes, height and weight, and operator fields. The capture time in seconds and PWV algorithm boxes should be left in the default settings. To begin the analysis, click Capture Data at the upper right-hand corner of the PWV screen. Examine the quality of the yellow ECG tracing on the screen. The spike of the R wave should be prominent. A small amount of artifact is acceptable as long as the QRS complex is tall and clear. If you notice that the ECG signal is poor, make sure that you have applied and placed the leads correctly. If so, try another lead configuration. Now use the tonometer to record 10 seconds of pulse waves at the pulse you have identified as Site A. In carotid femoral assessment, this is the carotid pulse. It is critically important that the foot of the pressure waveform, the location at the base of the large upstroke, be as clear as possible. Try different angles of the tonometer to produce the smoothest possible waveform. When you see 10 seconds of smooth waveforms crossing the screen, press the spacebar to record the data. The screen will direct you to perform another test on Site B, in this case the femoral artery. Once data capture is complete, the PWV report screen will appear. Determine whether or not the measurements just taken conform with quality control requirements. In most cases, both values in the standard deviation SD box must be displayed in green. In most cases, the plus or minus error must be less than 10% of the PWV value. If the test must be repeated, click on the Study button to review study details. Then click on the Capture Data button to return to data capture. To print the PWV report, click the Print button. SphygmoCor PWV assessment is complete.